All right, well, hi there, and thank you so much for joining us today. My name is Emma, and I'm from the Yinova Center. Before we dive into our discussion on COVID vaccines, for those of you who are new to either RMA or Yinova, I wanted to let you know a little bit about both of these centers, as well as tell you a bit more about our speakers. RMA of New York are leaders in state-of-the-art reproductive medicine. Their fertility clinic is led by an integrated team of doctors and scientists with extensive experience in fertility testing, IVF, egg freezing, and LGBTQ+ family building, and more. Yinova is an integrative wellness center acclaimed for its expertise in fertility and reproductive health. With 3 clinics in New York City and virtual services for people around the world, we work in partnership with our patients to realize their full potential. We offer acupuncture, Chinese medicine, body work, and virtual consultations from the field's leading practitioners. Dr. Lucky Sekhon is a reproductive endocrinologist, infertility specialist, and board-certified obstetrician and gynecologist who cares for patients at RMA of New York. She specializes in diagnosing and treating reproductive issues and has particular expertise in fertility preservation. Dr. Sekhon has dozens of scientific abstracts and numerous articles in peer-reviewed journals regarding personalized medicine, genetics, and embryonic gene expression networks. Dr. Sekhon is an assistant clinical professor at the Icahn School of Medicine in Mount Sinai, a fellow in the American College of Obstetrics and Gynecology, and an active member of the American Society for Reproductive Medicine. And then we have Dr. Noah Rubinstein, who is a licensed acupuncturist, board-certified clinical herbalist, and the chief clinic director here at Yinova. He is also a New York State paramedic and a volunteer COVID vaccine administrator. Noah has been in practice since 1997 and draws on a wealth of experience to treat everything from reproductive health to respiratory conditions and more. With a Western medical background, as well as extensive training in Eastern medicine, Noah recognizes and uses the benefits of each to effectively treat his patients. Many of you submitted questions prior to this discussion, which we're really looking forward to diving into. If you have any questions throughout, feel free to pop them in the Q&A box or in the chat, and we'll do our best to get to as many as we can. And with that, I'm going to pass this over to Dr. Sekhon and Dr. Rubinstein to get started.
Hi, everyone. Thank you for joining in on a Friday afternoon. I realize that we're the only thing standing between you and happy hour. So we're going to make sure that this is engaging and interesting, and hopefully we'll be able to touch on all the points to cover the questions that you asked. I guess, I could start with talking just generally about the vaccines, and Noah, feel free to interject if there's anything you want me to talk about specifically. But I'd love to just kind of start with an intro. I know that everyone is aware of the COVID vaccine. It's such a hot topic. We've been talking about it since December, when it became a reality that, it was on the horizon and was going to become available to all of us. And I think most people are very excited about it because this pandemic has just been dragging on and on. And no one really understands when it's going to end, how it's going to end, but the vaccine seems to be the one shining light at the end of the tunnel. And it seems like a very practical potential solution and way that this may come to an end. So, I've been very excited to talk about this because I think anytime there's a rapid advancement in science or in medicine, and there haven't been that many that have kind of come about so quickly in our time, I think this is a very unprecedented thing to see a vaccine being developed in this short time frame. And it's so crucial that, we get the word out about it and dispel myths and, talk through the misconceptions and what the concerns are. And we're not here to push it one way or the other. It's more about sharing information. I think, unfortunately, because this is such a fast developing issue and we're gaining information as each week goes by, the pendulum swings in one direction to the other. And so I think it's really on us as providers of healthcare to stay up to date and to do events like this to share this information with you. So even though I think everyone here is aware of what the vaccine is, I just want to give you my take and summarize how it works. There are really 2 major types of vaccines that are currently available. The first ones that came out, the Moderna and Pfizer, are what we call mRNA vaccines. And mRNA is basically like DNA, it's just another version of that code. And the mRNA that is being injected as the vaccine is basically the genetic code for the outer protein on the, the spike protein that covers the coronavirus. And what it's doing is we're getting this injected locally. It's traveling to the cells locally and basically teaching our cells how to make that spike protein, not the actual virus, just the coat of the virus. And then the next step is our immune system recognizes that protein that was built in our own bodies. And in the lymph nodes, which is part of our immune system machinery, so usually those are the nodes that are actually in the armpit region, that's where your body starts figuring out how to make antibodies against this spike protein. The hope is now that your immune system will commit it to memory, and if confronted with the coronavirus, it will be able to quickly recognize it and neutralize it before it can actually infect you. And that's how those vaccines work. So when we think about the other type of vaccine, it's actually not that different. It's just packaged differently. So Johnson & Johnson, AstraZeneca, these are basically using a different virus, a common cold virus called adenovirus, to deliver that genetic code to our bodies. So it's just a different way or a different mechanism or packaging, but essentially it's still the same concept of teaching your body how to make the spike protein, and then your body launches an immune response to it. And then your immune system has a great memory. Anytime you've been exposed to something, you're going to know how to react to it again in the future. So it's really clever technology. It's not the first time that vaccines like this have been produced. It's just the first time that they've been produced to this scale and for an issue like this. And this is the first time we've ever dealt with an issue like this, a global pandemic, right? I think there's a lot of skepticism about it because people are afraid that, well, how could something be developed so quickly without corners being cut? And there must be safety issues, and I don't want to be the guinea pig. But the reality is that they didn't really cut any corners. They did the trials, and all that was really cut out was the bureaucracy and the red tape and the paperwork, because this is an urgent issue and we needed to get this out to our first responders and to the general public. So that's how the vaccine works. There are the 2-dose regimens like the Moderna and the Pfizer vaccine, where the first dose kind of primes your system and then the second dose is a booster, and they're given 3 weeks or 4 weeks apart. And when we think about the side effects, the majority of patients or people that are receiving the vaccine are reporting side effects more so with the second dose, but there are some people like myself that actually felt worse after the first dose. And we don't really understand why. There are some theories that perhaps you've been exposed to it before, and so that first dose hits you a little bit harder, but we don't have any evidence of that. Only really 10 to 15% of people are having side effects, such as fever or feeling really ill after receiving a dose of the vaccine. So it's not across the board. And like I said, the severity might be different depending on which dose you're getting. The Johnson & Johnson, as most of you probably know, is a one-time dose. And I think, it's variable. It's hard to predict who's going to have a reaction and who isn't. There isn't one type of person that is known to have a reaction worse than other people. So, I think that it's scary and it's hard to know what to expect, but in general, we know that there is good safety data. And when we talk about the reactions to the vaccine, the most common thing is to just feel fatigued, maybe have kind of, a foggy head or have a headache, and just plan to take it easy. I would say for at least a day after you receive any dose. Most people are not going to have side effects that last longer than a day. But if you're really concerned and you are someone that tends to be really sensitive, you may want to give yourself an extra day on top of that. But generally speaking, it's going to be the day after you get whichever dose you're getting. And for the most part, it's just going to be feeling a little under the weather, a small fraction of patients or people will get fever, and it's okay and safe to treat the fever. There's a lot of misconceptions about that because, people will say, well, you shouldn't take Tylenol or Advil because it will neutralize the effects of the vaccine. That's actually not true. If you have a fever, you should treat it. You should stay well hydrated. You should rest. You can use a cold compress, wear light clothing, and you can take Tylenol and you can take Motrin to control the fever. They do say don't pre-treat yourself. So don't go into the vaccine saying, well, I'm going to prevent having a fever by taking medications beforehand. Not because we know for a fact it's going to decrease the efficacy, but there's this theory that, you need a normal immune response, and part of that is inflammation. And so don't give yourself anti-inflammatory medication before, because we don't know if it could diminish the effectiveness of the vaccine, and why take the chance? And it's probably unnecessary, considering that it's usually only 10 to 15% of people that actually get a fever after receiving a dose. So those are the main considerations. In terms of serious side effects, any vaccine site that you're going to is most likely going to be requiring you to stick around for at least 15 minutes. And that's to look out for something called anaphylaxis, which is a serious reaction, a serious allergic reaction where your airway feels tight, your difficulty breathing. Again, super rare event, but we saw a small number of patients in the vaccine trials who had that issue. And so out of an abundance of caution, it's a responsible thing to just kind of hang out, make sure you're feeling okay. And after 15, 20 minutes, you can go on your way. The other more serious thing that's been a topic of conversation this week is this idea of blood clots that has been seen in a few people that have received the Johnson & Johnson and AstraZeneca vaccine. And it's interesting because they both use that adenovirus to deliver the genetic code. So people are thinking that maybe that has something to do with it, that mechanism of action. But in reality, the numbers are extremely low, right? It was like 7 people out of 6 million, around there. So you're talking less likely than being struck by lightning, certainly far less likely to get a blood clot with these vaccines versus being on birth control or being pregnant, right? Because having those hormones in your body actually do increase your risk of blood clots. Now, the risks are low across the board, but it's just important to realize that relatively speaking, it's a very extremely rare event. But I think that people should feel comfort in the fact that, the FDA and the CDC are all saying, let's pause the J&J vaccine this week and maybe for the coming weeks while we just do an investigation and thoroughly review the data at hand. But so far from what other experts are seeing, it seems like a very rare event, and I'm not really concerned. So if you received that vaccine, I don't think you should worry. But if you have any concerning side effects or you're worried at all, talk to your doctor. The one other thing I want to touch upon, and then I want Noah to definitely talk about different strategies to tackle unwanted side effects, is how does this factor into trying to conceive, being pregnant, going through fertility treatments? I'm just going to tell you in a nutshell, there is no concern at all about the vaccine causing infertility or interfering with your ability to get pregnant. And that is not up for debate. That's something that the American Society for Reproductive Medicine, the American College of OBGYNs, and all major health organizations, including the WHO, are all on the same page with that. The reason I'm even making this statement is because there was a rumor that came out. Someone wrote a blog. It literally was just this blog called, I think, Health and Money News. And it was written by a pulmonologist, someone who wasn't even a women's health care provider. And someone said, hey, you know what? The coronavirus spike protein that the antibodies are being made against shares some similarities to a protein in the placenta. So here's this theory that maybe there could be some cross reaction. And that idea caught on like wildfire, and people got really frightened. And I think because there wasn't an intention to enroll women who were trying to conceive or already pregnant in the vaccine trials, that combination really just took off and people were extremely worried about it. I can tell you that since then, over 60,000, I mean, it's probably closer to 80,000, if not 100,000 at this point, but there were reports a month ago that over 60,000 pregnant women had received the vaccine in this country, and there really haven't been any red flags or ill effects. I work in a fertility practice, and I've had multiple patients since December. I treat a lot of doctors, teachers, people that had access to the vaccine very early on. And the large majority of them that were eligible received it. And I have not seen any change in pregnancy rates, in miscarriage rates. So you do not need to worry about that. Receiving it in pregnancy is another major question. And what I will say is, here's what we know about COVID in pregnancy. Pregnancy is a state of immunosuppression and compromise, right? Your body is allowing this pregnancy to invade your system, and half of it is foreign and not part of you, right? Part of your DNA. So you're more susceptible to colds and flus, and it is more dangerous for you to get COVID in pregnancy than not being pregnant. And although overall pregnant women who catch COVID do fine, and I'm not being an alarmist about this, you know, a lot of my patients have caught COVID and they're fine. But there is an increased risk towards being hospitalized, having more severe infection, and even death, and needing mechanical ventilation. And there is an increased risk to the baby of preterm delivery. And those are real facts that have come out of a year's worth of data. And, you know, based on how the vaccine works, it's not injecting you with a live virus. Some vaccines are live virus vaccines. This is not. So it's not dangerous to give this in pregnancy. And even in the trials that tried to say, we're not going to include pregnant women as our first line people that we're studying, there were 24 women that got pregnant inadvertently during the trial, and there were no adverse outcomes. I know that's a small number, but since then we've had many tens of thousands of women that have received the vaccine in pregnancy. And I think the data is all very reassuring. And I really feel strongly that anyone who wants this pregnancy, wants this vaccine, whether they're pregnant or breastfeeding, it should not be withheld from them, because I think that there are potential benefits to their health. We know that there are studies now showing we produce antibodies that can be passed in utero to the child, to your fetus and eventual infant, right? And this could be protective to them when you have a newborn. And we know that it does pass in the breast milk. So that's not the first reason that you get this vaccine. You get it to protect yourself, but that could be a secondary benefit. And we're going to continue to learn more about this. So I think, you know, it's an individualized decision. You can talk to your doctor to get more information and address any concerns you have. But having looked at all the data and keeping my ear to the streets and being concerned about this for myself as a breastfeeding mom who was pregnant during the height of the pandemic, I think it's amazing that this vaccine is available. And I'm really encouraged by the fact that so many pregnant women have received it. I think it's going to help keep them safe.
Thank you. That was really interesting. You'd mentioned also preparing for, there's a lot that you just mentioned that I definitely want to touch on in detail more. But you'd mentioned preparing for the vaccine and not taking, you know, like fever suppressing medications. And so I wanted to, we got a lot of questions actually about what can be done to help prepare your body and yourself for the vaccine and help kind of minimize those effects. And I wondered what you both thought, or if you wanted to share some thoughts on herbs and treatments. I'd love to hear that.
For sure. First, I'm really happy to be here with Dr. Sekhon. One, because I love doing these kinds of things with you, but also because this is a really important conversation for us to be having from this side, from this point of view, namely from the acupuncture, Chinese medicine, East Asian / alternative medical point of view, because there's an assumption a lot of the time that we're by definition going to be anti-vax. And that's something that's come up historically with pre-COVID vaccinations. And now there's sometimes actually surprise that we are as supportive of these vaccines as we are. And historically, it's actually interesting. The Chinese were some of the first people in the world to do vaccines. Literally thousands of years ago. We were treating smallpox, and so this is actually allopathic medicine. Vaccines like this are part of our tradition as well. So from our point of view, this is something that's in our tradition and important, given the current environment. A big focus, a primary consideration for us from our point of view is the patient themselves, and our preoccupation, our focus is often on the patient's health as well as whatever conditions they're facing. So preparation for the vaccine is actually an important part of how we see this working effectively, as well as care afterwards. On that specific point of taking things in preparation, yeah, for sure. Over-the-counter medications and things like Tylenol or Advil as a preventative, that's not a good idea. And then in terms of other things, a lot of the time people want to take herbs and boost their immune systems and start to do a lot of things in the lead up to the vaccine. And that's also something that we're kind of supportive of, but not without some clarification. First, if you're taking medications already, of course, whether they're for other conditions like asthma, digestive problems, cardiac problems, whatever your regular medication regimen is, of course, continue with that. And if you are already taking supplements like vitamin A to keep a healthy mucosal environment, or C or D or probiotic, these things, if you're already doing them, that's great, but we don't encourage people to start taking a ton of immuno-boosting or immunomodulating supplements like the week before, because what we want to do is we want to give your body an opportunity to be able to take on the vaccine, the information of the vaccine, in the form of the mRNA or whatever vaccine you're taking. And then on the other side, make sure that you are, one, not suffering with any significant threatening side effects primarily. Other side effects that may, as Dr. Sekhon mentioned, like super high fevers, especially if somebody's pregnant. We can manage a lot of these things. A lot of the vast majority of the side effects that people experience in the short term after getting the vaccine, these can easily be managed with over-the-counter medications and some herbs, but really the stuff that's most accessible, like Tylenol, is totally fine. And then there are things that we can do afterwards with our medicine to help with any lingering side effects, and also to just get people's bodies and health and immune systems back on track. And we do that both pre and post with acupuncture, Tui Na, which is like therapeutic massage, herbs, moxibustion, which is a kind of heat therapy that we do, cupping, which is something that people are often familiar with. We have a lot of different ways that we can help support a well-regulated immune system. And that's actually an important distinction that we want to make. There's a difference between this idea of building a stronger and stronger and stronger immune system versus a well-regulated and modulated immune response. And we've seen this a lot with COVID in a term that was used early on called cytokine storms, these sort of over the top immune responses that showed us that a stronger immune response isn't necessarily the end game, but a well-regulated immune response. And that's something that we help patients recognize with our sort of clinical insights by understanding who they are constitutionally. I think we all know people who have had the vaccine going into it who are constitutionally cold people, and their responses to it have been more chills and fatigue, whereas some people wind up with these super high fevers and uncomfortable and having responses in that way. And if you think about your immune system like an army, you want it to be smart. You don't necessarily need a bigger and bigger army that just goes bananas at the drop of a hat, but something that responds appropriately to whatever whatever it's facing. And so what we try to do through our recommendations, through acupuncture, lifestyle, nutrition, moxa, all of these different modalities, is we act as not so much as the vaccine itself does, but as an adjunctive to that care, to make sure that we're well prepared for it. And on the other side, that we recover from anything that may, from any experience launching an immune response, that's a bit of a stress on the body. And we want to make sure that people are in the best shape they can be in afterwards. There are probably more specific things that you're interested in, Emma, that we can begin to address.
Yeah, definitely. So I know, both of our communities coming here today are definitely going to be interested in fertility and reproductive health. And I saw a question come in on the Q&A, and someone had also submitted a question similar prior to that about menstrual cycles. So I wanted to touch on the vaccine and menstrual cycles. So I slightly paraphrase this question, but I'm going to read it out as if it was, as if I'm the person asking it. So the person said, I got the Moderna shot in the afternoon on Tuesday of last week. On Wednesday, I was tired, breasted a lot, and by Thursday, I had pelvic pain on a scale reminiscent of giving birth, like they had experienced a year ago. The pain had been mostly on the right side of their body, the same as the side that they'd gotten their vaccine. The pain continued Saturday and Sunday, shifting and changing in intensity and following into the next week. And so the question was, have you heard of this happening, and what could be causing this? How can they, prepare for their next shot, which inevitably will fall in a month, exactly when their period will happen again? And then, just your thoughts on the vaccine and the menstrual cycle. I'd love to hear that.
Yes, and I don't know if you're aware of this, but it is a huge hot topic that people have been writing about and talking about. Because a lot of women have noted or thought that their period might be a little bit irregular, or just not what it normally is after receiving the vaccine. And it's something people have said, so it's starting to be this widespread conversation. But I'll address the pelvic pain issue. I'm not surprised. And it also doesn't surprise me that there would be body aches and pains on the side of the body where the vaccine was administered, because as I mentioned, a lot of this is happening locally and then traveling to the local lymph nodes, which are part of your immune system machinery. And it hurts. You're going to have more activity, more swelling, aches and pains. And a lot of times you may have aches in your joints, right? Part of either having a fever or just not having a fever, but having a reaction that involves inflammation. It's going to happen in your joint. And your pelvis is a huge bone, right? And the points that often are affected in this type of a reaction are going to be in your back, in the joints that connect your pelvic bones to your spine. So I think that it's hard a challenge when it comes to pelvic pain, and women who have endometriosis know this all too well, is that you don't always know where the pain's coming from, because your pelvis has a lot going on. You have your bladder, the vagina, the uterus, you have your ovaries right there, the rectum, the intestines. So it's always hard to know exactly where the pain's coming from. But I think that it sounds like it may have been bone type pain. And I think that that's very typical, having joint aches and pains as part of an inflammatory systemic reaction to either an infection or having the vaccine. It makes sense. And I think a lot of times it can manifest as lower back pain, which can be confused with pelvic pain. And it's not easy to separate out the symptoms, but it doesn't surprise me. I definitely don't think that it's anything coming from the uterus or a gynecologic cause. With regards to irregular menstruation or people feeling like, why did my period come early or it came a little bit late? That's not shocking to me either. The thing that is regulating your period are a series of hormonal signals coming from your brain, right? Your pituitary gland. And they send out, the pituitary gland sends out signals to the ovaries. And the first egg to respond to that is the one that grows. And if you're not on birth control, right? And you're going to ovulate. And then the timing of that ovulation determines when you get your period if you're not pregnant that month. So major stress, major illness, inflammatory reactions, all of those things can impact that hormonal signaling, because all of these inputs are going to your brain. And we know that women under severe psychological stress, severe physical stress, people that have had a bad flu, all of those things can throw off your cycle. And it's because of the input to your brain saying, hey, there's something really stressful or different or funky going on. Maybe, right now we're going to shunt energy away from this pathway to something else that's going on that's bigger right now. And it can definitely mess up your cycle a little bit. Now, I don't think this is long lasting whatsoever. And also I should say, there's the bias of people really paying close attention to everything that's going on with their body because they just got the vaccine. So there's also that element of it too, because it's not uncommon to have a random change in your cycle just from month to month. That's normal cycle to cycle variation. And we might have a heightened awareness of all of that right now as well.
Yeah, I totally agree with everything that you just said, Lucky. First, all of those factors that you just mentioned, everything from hormonal cascades to an immune response, inflammation, all of these things can affect what is often a barometer for something else, namely changes in what women experience during their menstrual cycle. And so I don't see any reason, we haven't seen any reasons that this is enduring. It does make a degree of sense, even if we can't pinpoint the exact mechanisms. And it's also something that not only do we have more sensitivity to because we're going through this thing, if I understand you correctly, namely people who are acutely aware of their bodies because they just got the vaccine. But women also tend to be more sensitive and much better reporters about changes in their bodies than men do. I read about this recently, I think just 2 days ago. There was a thing in the Times about this question of how it's affecting menstrual cycles. And one of the things that came up was how much more information we're getting. It seems like there's a chance that women may be having more side effects, albeit relatively low-key ones, than men from the vaccines. However, there is really this question that comes up, which is historically women are much better reporters about changes in their bodies than men are. So that plays into it as well.
Interesting. I want to keep an eye on time and make sure that we can get to as many variety of questions as possible. So I noticed that there was a lot of questions about the vaccine throughout pregnancy. And it seems like the major theme is some more guidance on when is the best time to get the vaccine during pregnancy, if it's better to wait after the first trimester, and just wondering what your guidance is on that kind of, on timing for that.
Yeah, so it's really hard to know. There are different schools of thought, right? There is no known association between the vaccine and any harmful effects on pregnancy. Sometimes with certain medications, we'll say, you know what, wait till the end of the first trimester because that's when all the organs are forming and the pregnancy is most susceptible to toxins and, problems with development. So if you're ever unsure, wait. But in this case, I don't tell my patients that they need to wait. I say, look, I know that one of the risks of being pregnant is having a compromised immune system. I don't know all of the impacts that COVID could have on pregnancy. We are still learning so much, right? We know for a fact that overall, pregnant women do okay. And there seems to be no link, as there was with Zika, which was very scary. There's no link to, okay, we know there's a higher incidence of birth defects. That would be extremely frightening, right? So we're very happy and grateful that we don't have those types of concerns, but that doesn't mean we should take it lightly. There has been there have been some people looking at data sets, right? And again, we're all trying to learn from each other and share data. There have been some reports of, well, there might have been a spike in stillbirths, or there may have been other types of problems that have been more common in the last year. And we don't know if it's because of the pandemic, if it's because of COVID. We just don't know. So I can't in good conscience tell someone, well, out of an abundance of caution, even though we haven't seen anything dangerous about the pregnancy, the vaccine and pregnancy, just wait to be careful, you know, till the second trimester, because what if that woman contracts COVID in the first trimester, right? And I don't know what that means for the pregnancy. I don't know if it causes remodeling of the placenta. I don't know if it predisposes to a higher incidence of certain problems in the third trimester. We just don't know. And so I think that a lot of people are worried and think, you know, we should wait till there's more data on the vaccine and then I would consider taking it in pregnancy. But I feel like based on the available information, we know that it's dangerous potentially to get COVID in pregnancy and that you're more susceptible. And there are things that we don't know. The unknowns scare me as well, right? And then there's this vaccine, which we know is really effective at preventing serious infections and preventing death. And we know that women who have been vaccinated in pregnancy do have antibodies that are found in cord blood at time of delivery, meaning those antibodies are circulating in the fetus and now the newborn. And there is good data that's showing women who contracted COVID, the actual infection in pregnancy, their children at delivery had antibodies detected in their circulation. And the earlier in pregnancy they caught COVID, the more robust the level of the antibodies in the newborn. Right? Now, do we know that higher antibody levels mean more protection? No, makes sense. I mean, I would assume that. And we don't have this type of data on when women got the vaccine and the level of antibodies, but that data will come out. It just, there hasn't been enough time. But one can assume that it may follow the same pattern and it totally makes sense. So one advantage of getting it as soon as you can in pregnancy is that might mean more exposure for your baby to protective bodies. But we don't have proof of this. This is all theoretical. I think there is no clear answer of when to get it. I think you take it whenever you want to do whatever you can to protect yourself against catching COVID. I have no specific recommendation. Wait till the end of the first trimester. And I think that advising people to do that without having a real concrete reason could be potentially harmful, because there's that window of period then where you're leaving that woman vulnerable to infection. And we don't know everything there is to know about the infection in pregnancy.
Again, agree with everything Dr. Sekhon just said, that the risk to pregnant women at any point in the pregnancy of contracting COVID far outweighs the unknown risks from an honestly low data conversation. We don't have all of the information. There's emerging data about everything up to and including transplacental transmission of antibodies to the developing baby. And that's actually really encouraging news. I don't discourage patients from getting the vaccine at any particular points, but just as a point of clarification, because for a lot of the people who are here, this is going to come up as a conversation point with their doctors. And the concerns are, as Dr. Sekhon pointed out, one, there's a developmental concern early in the first trimester around the vaccine. And we don't know exactly what happens there. And again, the risks of exposure are tremendous in comparison to those potential risks. And the other concern that some people flag is one of reaction to the vaccine and possibly having a febrile or a fever, a temperature, or some other condition that might otherwise be threatening or compromising to the pregnancy. Again, there's really no data to strongly support this. I'm only bringing it up because these are the things that if you hear people talking about, this is what they're talking about, and to have an informed conversation with your doctor.
I brought that up because that was another major point that I completely omitted, and I wanted to address it. So thank you. The reason why people care about fevers in the first trimester is there are some data that suggest a higher incidence of birth defects in women who have really severe illness causing high fevers in the first trimester during development. Right? So there is a lot of debate that whether that's actually true. That's not like an accepted fact. It's something that's theoretical risk, and there are some data that show it, and there's a lot that don't. So it's questionable, but it's a real concern. And if I was in my first trimester and had high fevers, out of an abundance of caution, I would be aggressively treating the fever with hydration and Tylenol, which is safe in pregnancy. But yes, that's the one real material risk that I could say is, if you know that you're taking something that might cause this high fever. But again, 10 to 15% of people are getting the fever. And if you know to anticipate it, you could treat it. So I don't think that that's a reason to not get it in the first trimester, but it's certainly a discussion point. And I understand why people are concerned about that. And it is a consideration.
We had a few questions on the vaccine in relationship to assisted reproductive techniques. I might read out both, and I don't know if it's easy to lump them together or not. You can let me know. But one person wondered about timing in relation to going through their cycle and undergoing an IUI. And another person was wondering about timing it. They're going through IVF and they wanted to know if they should try and time the vaccine before the egg retrieval or after. So wondered what your thoughts were on that.
So we have some concrete guidance from the American Society of Reproductive Medicine, which came out a few weeks ago. And I'm so happy because it's just nice to have a uniform approach, because I think different fertility centers were coming up with their own algorithm, and some of them were probably over the top stringent, like, well, maybe just wait till next cycle. And I'm like, that, may delay someone's journey in a meaningful way. And I don't think that you need to do that. And what the ASRM is saying is it's okay to take the treatment, to take the vaccine at any point during your treatment, but a consideration would be to avoid any dose, whether it's the first or second dose of a 2-dose vaccine, within 3 days of any major procedure, meaning an embryo transfer, an egg retrieval, and I would say even an IUI. And it's logical because all of our centers now are being as responsible and careful as possible. We're checking your temperature when you walk in. You don't want to walk in on the day of your egg retrieval and have a fever, because everyone's going to be worried that you have COVID, and that's going to cause problems, right? And also in general, it's not great to undergo anesthesia and have a procedure if you're not feeling well. Have a fever. So it's not because it's going to have an impact on your egg quality or your success of the treatment. It's more so just keeping it simple and also just making you optimized on the whole, and so that you're feeling well on the day of your IUI or the day of your transfer for egg retrieval. We say wait at least 3 days till after one of those procedures, or do your dose 3 days before. And I think that's really good advice, because most people aren't going to have side effects that last longer than 3 days.
Yeah, and the only thing I have to add to that, and especially that is great that there are clear guidelines now. And the only thing I would add to that is if you are doing something, one, we recommend acupuncture around these milestones and any kind of procedure that a patient may be going through, but especially if the vaccine is in that window of time, again, beyond the 3 days, but somewhere in proximity to a procedure, then all the more reason to come to us and help with your response to the vaccine and preparation for it.
I've had patients actually, Noah, have said that they did acupuncture because they had aches and pains after one of the doses. And so this is a real great strategy.
Yeah, and one of the things that that people always know acupuncture is good for is what falls under this very large category of circulation. And what that amounts to, as we keep bringing up in different ways in this conversation, is a matter of regulation and inflammation and managing those two things, whether it's hormonal regulation around reproductive health or the inflammation that comes in part as a response to any of a host of things, including stress and vaccines. And also just on the level of stress, without belaboring that as the factor in all of this, for a lot of patients, it's a given for us that the vaccine itself is often one of, if not their first ventures out of quarantine. And it's not the reason that people are facing some of their health concerns, but as a contributing factor, as a part of what's making up their health at any given moment, that's significant.
We had a few questions about timing after. I'll just read a few out. They're a little similar to each other. So how long would you recommend waiting to get the vaccine after having COVID? And similarly, another person was wondering, so they had COVID back in December and was planning to get the vaccine now that they're past the 90 days, but was wondering if they should wait until they don't have antibodies anymore. I wonder what your thoughts were on that.
The 90-day wait period after an infection is clear. Like that's fairly standard, and that's the recommendation that comes down from the CDC. Waiting for some other shift in their antibodies isn't recommended. So when you've had an infection, you get antibodies. That's your body's immune response, and it develops a defense. And how enduring that is, how long that lasts for, is a little bit of a black box right now. However, you do develop some immunity. And so in some ways, the question is also, what kind of timing do you want to have? How soon do you need to do the vaccine if you've already got those antibodies? And what the data shows us is that the antibody defense, the boosting of your immunity, the regulation of your immunity from the vaccine far outweighs the antibody profile from having been infected in the first place. So waiting for those antibodies to go down, they're already down in comparison to what would be imparted by the vaccine. So we don't recommend waiting on that.
And I totally agree with you. And I think a lot of people, I overhear conversations all the time. I think a lot of assumptions are drawn from people's antibody levels, and a lot of people equate antibodies with immunity. And we know that that's not true. And we don't know enough about what the antibodies truly mean. I know people that have antibodies that have contracted COVID. So it's a big mystery. And I think if you want to err on the side of caution and do whatever you can to protect yourself, and you're someone who would be willing to take the vaccine, I wouldn't come up with my own algorithm, because we just don't know what the antibodies mean. My advice would be to pretend the antibodies aren't there and operate under that assumption and do what you would do regardless.
And this also brings up a really important point, especially for all of us, for patients who are working in either one of our clinics. And that's what we loosely refer to as being imbalanced. That's a word that gets thrown around a lot, certainly from in our clinic as alternative medicine practitioners. And it can be a flaky word, but it's important to remember that when we talk about balance, what we're talking about, if everybody remembers back to high school science, is homeostasis, is your body's ability to regulate multiple systems that are all doing ostensibly different things. And that's where these questions of regulation and inflammation and response all come in. And on this particular point of the antibodies, this is a good case in point where it's not about your specific immunity to a specific issue. The antibody count as an isolated element doesn't really speak to your health, your body's ability to regulate and respond appropriately, and especially in reproductive health. these are the things that we see even outside of COVID, and especially with this conversation, this is important stuff to consider.
I wanted to just quickly pause. I know, Dr. Sekhon, I think you need to leave soon. So I wanted to just create that opportunity for you to head off if you needed to leave now. And I wondered, Noah, if it would be okay to stay on for another couple minutes. We still have a few more questions. Maybe we just like
Sure.
And if there's any questions that get sent in that you want to build my way, I'm happy to send you answers and you can post them through your channels.
Thank you. That's really generous of you. Thank you.
Actually leaving because my husband has to get his second dose. So I need to go relieve him from his babysitter duties. But thank you so much for having me. And I would love to do this anytime. I know questions will continue to emerge because this is an evolving picture and it's confusing and not straightforward. But if anyone has any questions about the vaccine, about fertility or pregnancy, I'm here for you. You can contact me through Emma.
Wonderful. Thank you so much, Dr. Sekhon. It was so nice to speak with you today.
It
Good
was
seeing
great.
you, Dr. Sekhon.
Thank you so much, Noah. Thanks, Emma.
Thanks.
Bye.
So Noah, now then there were two. So we had a bunch more questions, and I know that we're pressed for time and there's maybe no way we were ever going to get through all of them, but I wanted to try and get through a few more. So we've covered menstrual cycles, we've covered some reproductive health questions and pregnancy. Someone had a question and wondering about, so I'll read it out. They said, as a cancer survivor on tamoxifen, I'd love to know if there's any research on the vaccines and hormones, and if there are any vaccine trials on women on tamoxifen. And I wondered if you've heard of that, or if you've.
Yeah, that's a really good question, because a lot of our patients are coming into us with these questions about medications or regimens or plans that they have for different kinds of treatment and how the vaccine may play into that. And it's a conversation to have with your doctor. There's actually there's a schedule of medications, some of which fall into this column of biologics, that the recommendations are a little bit different in terms of when to take the vaccine and how to schedule that with your current regimen. I don't know specifically what it is for that long-term tamoxifen patient. However, if I'm not mistaken, the recommendations are the same, and that it's fine. But it's definitely, whenever you have a question about this kind of thing, check with your doctor who's prescribing that medication specifically. Like, don't ask your pulmonologist about something that your oncologist has you on. That said, the range of medicines, and these go for, and when I say the range of medicines, meaning the medications that people who are going through different kinds of cancer treatments are on, or certain autoimmune condition medications, there are some issues that come up. And that's a complicated list. Again, the data is low. One of the amazing things, is Dr. Sekhon pointed out early in the conversation, is that corners haven't been cut in terms of the rollout. We've been doing mRNA work with vaccines literally for decades, and we really fast-tracked cut through a lot of red tape. There are a lot of ways that this rollout has been expedited that didn't cut any corners. And yet at the same time, there are some things that just require time. So in those initial trials, people trying to conceive, people who are pregnant, people going through cancer treatment, these things weren't always, we just haven't had the time to really observe how those are going to play out. I can't say 100%, but I think tamoxifen, it's okay.
Thank you. I had a question. Hi, Toby.
Yeah, if I had the luxury earlier of being able to mute while Dr. Sekhon was talking, as my puppy here was having a meltdown. I apologize in advance if he chimes in.
That's okay. We're almost at the end anyway. We had a question about immune systems more generally past the vaccine and more just in relation to this pandemic that we've all been, collectively going through. So many of us haven't been sick in over a year. I know I haven't had a cold and I don't even remember the last time, which is uncharacteristic for usual me. And so with everyone, wearing masks and washing hands more and staying at home, do you think that this creates any risks for our immune system in the coming months or years? Or is it a problem that we haven't been, exercising our immune system? I wondered what your thoughts were on that.
Yeah, this gets back in some ways to what we were talking about before, namely this idea of a well-regulated immune system. And if you think of your immune system as an army of sorts, part of its exercise, part of what keeps it tuned is managing the small brush fires or exercises in waking it up periodically. A lot of people have been dialed back in not only their exercise, but their nutrition habits and all kinds of things, because it's been a year like that, and that's fine. I don't know that that's necessarily had a significant impact on our immunity, and I don't think we're going to come out of our homes and be demonstrably more susceptible. With that said, though, now is a good time to think about the ways to begin, especially with some of the social distancing requirements being reduced a little bit, us being able to get outside, warmer weather, and most of all with the vaccine online, activity becomes an increasing option for us. And that's obviously super important. When it comes to other things that people can do, there are things like the vitamins, like we spoke about before, vitamin A to help maintain a healthy mucosal lining. And because it's the mucosa that is in most ways the point of entry for the virus. Vitamin D to help maintain a healthy immune function. Probiotics, your gut is, especially if our dietary habits have changed demonstrably. A lot of our patients at the Yinova Center are talking about their digestion and how that's changed since they haven't been eating the same, ordering in more, less active. All of this stuff plays into it, and your gut is actually a huge modulator of your immune function. So something like, one, eating well and getting that back on track, but also probiotics, prebiotics, enzymes if you're having actual stomach problems. There are supplements that can help. Obviously, acupuncture can be really, really valuable when it comes to regulating immune function, as well as herbs. Again, people's individual constitutional profiles, that's at the heart of what we do. And so my sort of immune hiccup from not being as exposed, in other words, not being as active and self-caring as I might have been over the last year, may be different than yours, Emma. And so what we do in our clinic is help people recognize what is unique to them and how they can best take care of themselves. And we do that with the acupuncture, herbs. Cupping and moxa are incredibly powerful immune supporting techniques. And so we do a lot of that now because their cascade, it's not just about muscle relaxation or warming, but we have adjunctive techniques that really help with this question of immune function.
Thank you. That's helpful. We had a few questions about post-vaccine, and I'm definitely keeping an eye on time, but maybe we can see if we can squeeze them in. So there are two kind of similar-ish, not really, but questions about post-vaccine. So one being in terms of physical activity right after the vaccine, is that a bad idea? Should that be avoided? In particular, I think they mentioned that they had a chiro and a PT appointment for their back and shoulders for soon after their shot.
Okay.
Would that be advisable to avoid or to reschedule?
Actually having gone through both vaccines and treating a lot of patients who have gone through both vaccines, and also helping administer the vaccine. So speaking with just dozens and dozens of patients who have at least had one shot. I wouldn't make any plans. I would buffer, especially the second shot, with that 3-day window that we were talking about around procedures. Even less serious things like chiropractic adjustments, acupuncture treatments, or certainly things that take a lot of energy like physical therapy. I'd probably back off on that because your body's launching an immune response. And we all know people who have had varying degrees of reactions to it. Some people do okay. They take care of themselves, and it's not the people that don't do okay haven't taken care of themselves, but some people tolerate it just fine, and within about 48 hours they're ready to go. Some people, for reasons that we don't entirely understand and aren't linear, meaning we can't always predict, it's like getting hit by a truck, and it doesn't last long. It's only 24 to 36 hours, but I think it's in our interests to give our bodies that chance to rest, recuperate. Hydration is absolutely at the top of my list on recommendations. I and Jill, my wife, we drank over a gallon of water the day before, the day of, and the day after. And whatever the correlation may or may not be, we got away with minimally sore arms and a little groggy the next day, but we got through that second shot without a hitch. There are a lot of reasons that even if you do wind up having side effects from the second vaccine, seriously hydrating yourself is really, really important, one way or the other, no matter what. When you do these vaccines, rest, really important. Give yourself the space for that. Hydrate, no question. Like, that's really important, because like after any infection, your body's going to need to clear this stuff away out of the lymph system, out of the bloodstream that we were talking about before, and water is the way that happens.
Thank you. I wonder if we have time for just one more. It's a little bit, not a total departure, but in terms of deciding whether or not to get the vaccine. So I wanted to just read it out. So it said, I've had a neurological reaction after a vaccine years ago, Gardasil 2007. I'm definitely not pronouncing
Yeah.
that resulted in intermittent loss of both motor and sensory function in my arms and shoulders on both sides over the span of around 6 months. I've not received any vaccine since then out of fear, but would like to get vaccinated against COVID if appropriate for my situation. So they were wondering if you had any insight into a reaction like this, or any suggestions for deciding whether or not this vaccine is appropriate, and or how to mitigate a neurological reaction like that from an Eastern perspective. And they also mentioned a Western perspective. So I just want to I don't know who this is because it was submitted anonymously, but I'll pass this along to Lucky too. And if you could just DM me or email, I can let you know what she says too. But no, I'd love to hear what your thoughts are on that.
So getting back to the beginning of the conversation, that where Dr. Sekhon was explaining about the mRNA vaccines and what these vaccines are, they're a completely different animal when it comes to the type of vaccine. And a lot of the time, one of the reasons that we've so wholeheartedly gotten behind these vaccines is because the mRNA technology that these vaccines are on the back of it's something that we haven't had in this way before, and the Gardasil is not an mRNA vaccine. So that, like other vaccines, side effects from those, including this sort of enduring neurological concern, it's a different conversation. Maybe there are two things that come to mind in response to that. One is, it gets back to what the risks of not getting vaccinated are. And that is a more of a known than the unknown of the risks of getting vaccinated. These guidelines are changing a little bit, but there is a recommendation about patients who have any kind of reaction to the first vaccine and whether or not they should do the same vaccine for their second one. So patients who have any kind of, and by reaction, meaning evidently allergic reactions, short term, whether it's even something as simple as itchy skin. Right now, the recommendation is to not get the same vaccine again for fear of a more significant, what Dr. Sekhon was talking about before, anaphylactic reaction. And by the way, if you want, I can also take a minute to talk about what the vaccination process is for people, because in the vaccination sites, that's also a bit of a black box. People don't always know what's going on in them, and I can kind of break down what the process is there, if that would be helpful. But what I would say is this is a different kind of vaccine. The concerns really that we've seen with this, obviously with the J&J, there's some concern around the blood clotting. Everything else right now is anecdotal, and the side effects, if any, that we're seeing with the mRNAs are super short term. So I would have the conversation with my doctor, but I would not withhold. I would not get this vaccine because of that experience.
Thank you. We're running out of time, so I don't know if we can get to everything else, but I think we'll have to stop here. And I wanted to mention, if this is something that you'd be interested in potentially a part 2 on, or if I know that there's tons more questions, so send me an email if that would be something that you would be interested in. We can try and set up another time with Noah and Dr. Sekhon. I think that would be great. But I just wanted to thank you, Noah, for taking time out of your day to speak more on the vaccine. And it was really interesting to hear both you and Lucky's insights towards the vaccines and how to prepare and time it and all of that. Thank you so much.
Thanks for hosting this and having it. And yeah, there's so much to talk about, and we're going to learn more in the coming days and weeks and months. And if there's anything more specific, or if anybody has any questions, direct them to him, and we'll definitely get back to you.
Great. Definitely, I think
All right.
connected to the Zoom invite, but I'll just pop it in the chat box. If anything comes up, definitely just shoot me an email. And thank you everyone so much for spending your Friday afternoon with us.
Thanks, everybody. Have a great weekend.
Have a great weekend, everyone. All right.